Okay, so from upper limbs, we will
Yeah.
get nearly 8 to 10 questions in MRCS part A. We must put importance, and anatomy, we should not miss a single mark in the exam because other topics are unpredictable. Pathology, pharmacology, unpredictable. You cannot predict. But anatomy, you know that they will ask about dorsal scapular nerve arises from which root value. They will ask about root value of
C5.
long thoracic nerve of Bell supplies which muscle. Okay. They will ask
Hmm.
about which of the following muscle is not supplied by the musculocutaneous nerve of arm. So you know musculocutaneous nerve of arm supplies BBC.
BBC.
What is BBC?
Brachialis, biceps brachii, and coracobrachialis.
Okay. What are the nerves arises from the posterior cord?
So posterior cord ulnar is the mnemonic, upper and lower subscapular nerve, nerve to the distal dorsi, axillary, and the radial nerve.
Okay. Okay, good. Then in Erb's palsy, which nerve root is affected?
C5, C6.
Okay. Axillary nerve supplies which muscle?
Axillary nerve supplies deltoid and teres minor.
Okay. What is the main function? What are the functions of deltoid muscle?
Oh, so deltoid has three parts: clavicular, spinal, and acromion. The clavicular part, it abducts the shoulder and does the lateral rotation, and then the spinal part, it I don't know what does it do.
Just the opposite.
Lateral rotation, abduction, and lateral rotation.
Carry on. And main
And then
function?
adduction and medial rotation. The second part.
Mm-hmm. Second part, or you can say it. Dr. Sanjita, have you gone through the yesterday's lecture? It was not a qualitative video, but at least we can recap from there.
Yeah, I watched the video. Yeah.
Okay. So median nerve arise from which root value?
C8 to T1. Which root?
Hmm? Median.
Two roots. It has two roots. Uh, Medial and the lateral cord.
Okay. And their cutaneous distribution in the hand.
Cutaneous distribution in the hand is the median nerve. It supplies median nerve is 3.5 thenar muscles, and
Uh-huh. Good.
3.5 thenar muscles, lateral two
Two
lumbricals,
lumbricals. Uh-huh. And
lumbricals, and all the flexors of the arm, of the forearm, except the
except.
flexor carpi ulnaris and the medial and the ulnar part of the flexor fundus, and this is what it supplies. Yeah, yeah, and the tips, posterior tips of the 1, 2, and 3 till the mid of the ring finger.
Okay, good. What is ulnar paradox?
Ulnar paradox is the more proximal the lesion, less the ulnar.
Mm-hmm. Very good. All the question I'm asking, this is actually MRCS part B question. You are in a good track. Okay. So yesterday we have seen up to here deltoid and trapezius. Trapezius also three kind of fiber, not important for the exam, just for our orientation. And trapezius function is important. Trapezius, what does it causes? It causes elevation, elevate, retract, and rotates scapula. Okay. Mainly it elevates the scapula. Okay.
Hmm.
Descending part elevate, transverse part retract, and ascending part depress. Okay. Remember this thing. Descending part. Trapezius has descending part, transverse or
Elevates,
horizontal, and ascending.
ascending part depress, and transverse part retracts.
Yes, ascending part depressed, it is like opposite. Okay.
Hmm.
And descending part, which is coming down, it actually causes elevation. Opposite, right? Descending part,
Hmm.
descending going down, but it causes elevation. See from the picture, this is descending part. But if it is functioning, that causes elevation of the scapula. And ascending part, it causes depression of the scapula.
Hmm.
And transverse part, it causes retraction.
The retraction. Mm-hmm.
Latissimus dorsi, they ask about the nerve supply. Latissimus dorsi is supplied by
Nerve
thoracodorsal nerve.
to,
Thoracodorsal
yeah,
nerve,
or nerve.
cervical 5, 6, 7. Sorry, 6, 7, 8. And deltoid is supplied by axillary nerve. Very important.
Axis.
Deltoid we cannot miss. Now see this is a common question. During mastectomy, this is a mastectomy question. During mastectomy, which nerve, which artery, which vessel can be affected? Okay. So here we have thoracodorsal nerve, one nerve. We got thoracodorsal nerve. Then we have intercostobrachial nerve, number two, and long thoracic nerve, number three. If any
Hmm.
one of these three nerves is in the option,
Can get
they are the
affected.
correct answer. Yeah, that will be the
Okay.
correct answer. Thoracodorsal nerve, intercostobrachial nerve, and long thoracic nerve. If any one of them is in option, that will be the correct answer. Which
Okay,
vessel?
all right. Thoracodorsal.
Artery. Artery will be thoracodorsal artery. Which vein? Thoracodorsal vein. Okay. So thoracodorsal nerve, thoracodorsal artery, thoracodorsal vein, other nerves like long thoracic nerve and intercostobrachial nerve. Mostly intercostobrachial nerve. Mostly. The option mainly.
Intercostobrachial. Right. Okay.
Uh, okay. So what are the vessel can be affected during mastectomy?
Thoracodorsal artery, thoracodorsal vein,
And nerve.
thoracodorsal nerve, intercostobrachial nerve, and long thoracic nerves.
Yes. Now blood vessel. Okay.
Yeah.
So here, Dr. Sanjay, you are with us.
Yes, yes, I'm there. I'm listening.
Okay. We will be more interactive. Okay. So this is our heart. Okay.
Hmm.
From here we are getting brachiocephalic trunk. This is brachiocephalic trunk. Then brachiocephalic trunk is dividing into two. One is common
Carotid,
carotid, common carotid,
carotid, and
and another
subclavian.
one is subclavian. Okay.
Right.
Very simple. This is right side. So right common carotid and right subclavian. From the
Hmm.
brachiocephalic trunk, right common carotid, right subclavian. And right subclavian
Hmm.
coming when it crosses the
Posterior.
inferior margin of the clavicle, its name changes and it becomes axillary
Axillary
artery.
artery.
and axillary artery comes down, 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 and then
I
it
think
will
pect major.
pectoralis major, minor.
Is it minor? I don't know. Minor?
Okay, we will see. Then it changes the name, brachial artery,
Brachial artery. Yeah, brachial
brachial
artery.
artery.
Yeah.
Then brachial artery also will divide into radial and
Ulnar
ulnar
and radial.
arteries. We will see.
Hmm.
We will see. But this is the gross.
Hmm.
Now, same the vein, internal jugular vein connecting with subclavian vein. Internal jugular vein connecting with subclavian vein to form which one? To form
Internal jugular vein connecting the
subclavian vein,
subclavian vein to a brachiocephalic trunk? No, no. Superior vena.
superior vena cava. Yes, superior vena cava. This is very confusing. Very simple but confusing. Even in
Yeah.
with my consultant in one, we were doing one a mastectomy actually. He asked me about axillary vein because practically we put more emphasis on axillary artery, axillary uh, uh, brachial artery, subclavian artery, but vein we read very less. That's why I was confused and I was totally throat blocked.
Hmm.
So axillary vein continues and it becomes the subclavian vein, and subclavian vein join with internal jugular vein and they form the superior vena cava, which open into right atrium,
Hmm.
right?
Hmm.
Okay.
Hmm. Hmm.
Then axillary, we have lateral thoracic vein, brachial vein, lateral thoracic vein. They join into axillary vein or they drain into axillary vein. Axillary vein drain into
Yeah.
subclavian vein. Subclavian along with internal jugular, they form the superior vena cava.
Superior vena cava. Yeah.
Okay. Here we can see again. So we got the subclavian artery, right? This is subclavian artery. This is
Yeah.
first rib, first rib. When it crossed, I said some mistake was there. I said about the clavicle. The relation will
Clavicle. Yeah,
not
but
be
it's
with the clavicle. It should be
superior
with the
margin
rib.
of the first rib.
The rib, yeah. When it cross the lateral margin of the first rib, then it takes the
Hmm.
name of axillary artery. So subclavian
Axillary
artery
artery.
becoming axillary
Yeah.
artery and axillary artery coming down, 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 and there is
Yeah.
teres major muscle. You're right. That was
Teres
teres
major.
major. Yeah,
No, I said pect major. I was wrong. It was teres major. Sorry.
teres major. Yeah, it is teres major muscle. When it crosses the inferior border or margin of teres major muscle, it takes the name of brachial artery. Same artery, but in different place, taking different names. So first is
Yeah.
subclavian artery when it is crossing
Subclavian
the.
artery, the
Mhm.
the lateral border of the first rib, it becomes axillary artery, and then axillary artery goes down in the lower border of the teres major. It becomes the
Brachial artery.
brachial artery.
Yes. So subclavian artery, then axillary artery,
Axillary.
then brachial artery. Now, axillary artery, again, it has three parts. First part, second part, and third part. How it is divided? It is divided by, now will come pectoralis major. Okay. In this relation, we will have
Ah,
pectoralis
okay.
major. So part before the pectoralis major, this is first part. And from the first part, we have only one branch. From the first segment, we have one branch, that is superior thoracic artery. These all are
Superior
important.
thoracic artery.
From first part, only one branch, that is superior thoracic artery. This is superior thoracic artery. You can see from the first part, we have superior thoracic artery. Then, second part. Which part is second part? The artery which is just beneath pectoralis minor muscle. Pectoralis minor
Pect,
muscle.
pect,
Pectoralis
minor,
minor.
pect minor.
Mi minor. Minor.
Okay.
Pectoralis
So
minor.
teres major was dividing the arteries, and pect minor is dividing the axillary three parts.
Yeah, yeah.
Okay.
So pectoralis minor muscle, sorry, the part of the axillary artery just beneath the pectoralis minor is the second part. Just this part. This is the second part. Okay, this
Okay.
is second part. From second part, we have two branches. One is thoracoacromial artery and lateral thoracic artery. No matter how many times you read, you will forget. So again and again and again, and before the exam, revising is the key to remember. No other option.
Hmm.
So from first segment one, that is superior thoracic artery, from second segment two, that is
Lateral thoracic.
thoracoacromial and lateral thoracic.
Lateral
Supe-
thoracic.
superior thoracic,
Thoracic.
superior thoracic we got from the first segment, and lateral thoracic we got from the second segment. Okay, and from the third segment, we have three branches. From third segment, we have three branches: suprascapular artery and lateral and medial circumflex artery. You can see
Suprascapular and lateral.
suprascapular artery and suprascapular artery, again circumscapular artery, no need. You remember suprascapular artery and
It's
anterior
subscapular. It's not supra. It's subscapular.
subscapular. I mean, yeah, subscapular artery, anterior humeral circumflex, posterior humeral circumflex, as like the femur. In the femur, it was medial circumflex femoral artery, lateral circumflex femoral artery, and here it will be anterior circumflex humeral artery, posterior circumflex humeral artery, and
Humeral
subscapular artery.
arteries. Subscapular.
Okay,
Okay. All right. Yeah.
so
Okay.
can
All
you
right.
explain all the branches starting from subclavian up to the brachial?
So, okay, so the subclavian artery, it arises from the brachiocephalic trunk of the aorta, and then it continues down on the lateral body of the first rib. It continues as the axillary artery. The axillary artery is divided into three parts by no, the axillary artery then at the level of the pectoralis major muscle. It gets
Minor,
pectoralis major muscle. Pect
minor,
minor is it?
minor. Hmm.
Okay. So at the pect minor muscle, the axillary artery then now becomes the brachial artery, and then the brachial artery, the cubital thing,
Hmm.
cubital fossa. I don't know, maybe it is divided
Again,
into the
again,
ulnar and
again.
ascending artery.
Pectoralis minor dividing the
Yeah,
axillary artery into
pectoralis
three segments.
minor, it divides the axillary artery into three segments. Segment one has one branch, which is a superior thoracodorsal artery. Then the second has two branches.
Superior
The
thoracic, only superior thoracic.
Yeah, only the superior thoracic artery. Then the second part has two branches, which is the lateral thoracic and the dorsal
Thoracoacromial.
thoracoacromial. Yeah, lateral thoracic artery and the thoracoacromial artery, and the third has a subscapular artery, and the here goes to the circumflex humeral artery.
Okay. Dr. Sanjay, you can explain. You can explain axillary artery and its three
Okay.
branches.
Okay. In axillary artery, sh- it has three segments. First segment is one branch, superior thoracic artery.
Mm-hmm.
Second segment, two branch, thoracoabdominal artery and lateral thoracic artery. And third segment has three branch, the subscapulaar artery, posterior humeral circumflex, and anterior humeral circumflex artery.
Okay. And this three segment is divided by which structure?
The three segment is divided by the pectoralis minor.
Minor. Yes, pectoralis minor. And which structure divide axillary artery into brachial artery? That is another
These
muscle,
three, um,
teres major.
teres major.
Teres major. Teres major. Yeah. Okay. Good.
I always
Yeah.
forget this. Teres
Everyone
major
forget
and
this.
pec minor.
Everyone forget this.
Yeah.
Okay. Now, again, a gross look about the nerve. We have seen before from cervical 5 to thoracic 1, this is our brachial plexus. It has medial cord, lateral cord, right? And
And
from the lateral
posterior cord.
cord, and posterior cord, from lateral cord, we are getting important nerve, musculocutaneous nerve supplying BBC,
Musculocutaneous nerve. Yeah.
and median nerve always remains in the medial aspect of the arm,
Yeah.
and it passes the elbow anteriorly in between two epicondyle. Radial nerve, it crosses anteriorly or posteriorly? Radial nerve,
Radial nerve posteriorly.
very bad, very bad. In the elbow, it will come anterior, only in the
Is
elbow.
it?
Radial, only in the elbow, it will come.
But radial, yeah, yeah, yeah. But it supplies the posterior everything, yeah.
Yes, yes. We are discussing the elbow,
Yeah,
in the elbow.
yeah, yeah, yeah. Okay.
And ulnar, ulnar
Ulnar medial epicondyle. It passes behind the medial epicondyle.
behind. So
Behind.
ulnar will be behind, median will be in front, and radial will be remains behind. It supplies behind, but it in the elbow it crosses anteriorly. Okay,
Anteriorly. For
yeah,
short time. Yeah.
for short time, only for short time, only in the elbow. It remains whole through its pathway. It remains in the posterior, just in the elbow it comes front, again goes back. Now
Yeah.
we came to know that all plexors are supplied by median nerve except
Median nerve, except the flexor carpi ulnaris and the medial,
half
sorry,
of
half of the
mm-hmm, flexor digitorum
flexor
profundus.
digitorum profundus.
Yes.
Yeah.
Okay. Okay. There is the anatomical like canal like structure which is called Gaon canal. Gaon canal. Which
Mm-hmm.
nerve remains here? Ulnar nerve. A fixed
Ulnar
question.
nerve.
Which nerve remains in Gaon canal or ulnar nerve remain in which canal? Gaon
Gaon
canal.
canal.
Yeah.
Yeah. And median nerve is the carpal tunnel.
Yes. Median nerve remains below the below
Median nerve remains below.
Mm-hmm. There
Plexus,
is one.
no, flexor retinaculum.
Yes, there was one more picture. We will get one more. We'll see there. Okay. Just remember one thing. Median nerve, we said that carpal tunnel syndrome. When we will read carpal tunnel syndrome, we will know that flexor nerve, when it crosses from forearm to the wrist, it it goes below the flexor retinaculum. But before before entering into flexor retinaculum, they give another branch. Median nerve gives another branch, which is palmar cutaneous branch of median nerve. Very important. Palmar cutaneous branch of median nerve, and this, see, and this is the median nerve. Median nerve going here, and this is flexor retinaculum. So median nerve goes below the flexor retinaculum.
Below the flexor retinaculum, but before that, it gives a
Before
palmar
that,
cutaneous
it
branch.
gives a palmar cutaneous branch, which gives supply to the thinner eminence. This is thinner eminence in this area, specifically this area.
Hmm.
Okay, so even okay, this is also one exam question. Which branch of the median nerve gives supply to thinner eminence? This is palmar
Palmar.
cutaneous branch. Hmm.
What
Now,
about the anterior introitious nerve? Anterior
i-
introitious is
i-
the most
pure motor, yeah, pure motor branch of median nerve. We will see. Now we will go that uh, topic. Okay, here a little more. Median nerve, when it passes the elbow, it gives a pure motor branch. A pure motor branch, which is called anterior interosseous nerve. This
anterior introitious branch.
interosseous nerve, and it is a branch of median nerve. From this picture, you can
Median
see,
nerve.
and it gives supply to the flexor of the forearm. What are the muscle? Pronotor teres, flexor pollicis longus,
Got.
pronotor quadratus,
Yeah.
then flexor digitorum superficialis, pronotor
Flexor
teres,
digitorum.
flexor carpi radialis, palmaris longus, and flexor digitorum profundus, but lateral half of the digit.
Lateral half.
Lateral half.
So
Lateral half.
all the superficial and deep muscles.
In the forearm, in the flexor aspect, it will be supplied by the median nerve, especially by the AIN, anterior interosseous nerve.
Hmm.
Now, see, in this question, anyone can read this question.
10-year-old boy is admitted to the emergency department following a fall. On examination, there is deformity and swelling of the forearm. Ability to flex the fingers of the affected limb is impaired. There is no sensory impairment. Uh, Imaging confirmed displaced forearm fracture. Which of the nerve is likely to be affected?
Hmm. See, some clue are no sensory impairment means the nerve which is affected, that is not a sensory nerve, that is a motor nerve. So we know motor nerve, and uh, he is the ability of the flex of the finger to the affected limb is impaired, means flexion is impaired. So we know
Yeah.
flexion is done by
Median nerve,
median nerve,
osseous, anterior and osseous.
and median nerve also specifically they are saying no sensory impairment. So median nerve has pure motor branch, anterior
Yeah.
interosseous. So the anterior interosseous nerve is a branch of the median nerve that supplies the deep muscle on the front of the forearm, except the ulnar half of the FDP.
Yeah. Yeah.
Okay. Anterior interosseous nerve, very important, very important. This is exam question, both part A and B. Which are the muscles supplied by anterior interosseous nerve? Two and half muscle. Two and half. What are the two muscle? Flexor pollicis longus. This is one muscle. Another one, pronator quadratus. And another we have flexor digitorum profundus. But it has flexor digitorum profundus are actually four in number. Flexor digit except the thumb. Flexor digitorum profundus goes to second, third, fourth, and fifth finger. Okay, except thumb. So this lateral two is given by the median. So lateral two out of the four tendon is supplied by the AIM. That is why it is considered as half. Okay.
So I thought anterior interosseous nerve supplies all the muscles of the forearm. Am I wrong? All the muscles of the forearm, pure motor,
None.
all the flexors of the forearm. No?
No. 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 Two and half. Two and half. Flexor pollicis longus and pronator quadratus. Also
Pronator quadratus,
lateral two tendon of
flexor
flexor digitorum
digitorum
profundus.
profundus,
And medial two will be supplied by
ulnar.
ulnar. Ulnar.
Okay, flexor pollicis longus, pronator quadratus, and flexor digitorum profundus. Okay, all right.
Now see
Point 5 and 6.
pure motor median nerve. Okay. One more question. You can read this one.
Uh,
Okay. Yeah,
yeah, you can continue now.
it's alright, Sanjita. You can read the question.
Okay. A 40 years old lady trip and fall through a glass door and sustain a severe laceration to her left arm. Amongst her injuries, it is noticed that she has lost the ability to adduct the and a finger of her left hand. Injury to which of the following nerve is most likely to account for her examination findings?
Hmm. This is an important clinical examination. When we receive any patient in ER, especially after any hand injury, we very commonly perform this test. Hold the paper. We ask the patient, hold the paper with two thumb, and this is examiner finger. Suppose this is Dr. Sanjita, and this is the patient. Came with a RTA, and you are suspecting that this patient has some injury. Maybe he is having some median nerve injury or ulnar nerve injury. You don't know. So nerve injury we cannot detect from any of the investigation except nerve conduction test, right? But initially, how you will differentiate by some clinical examination? Just simply tell the patient, hold this paper, and this is your finger. Patient will also hold in the same pattern. See, this is the normal thumb. But you will try to pull the paper towards you. You instruct the patient, don't let me take the paper from you. Catch it tightly with your thumb and this index finger. Okay. But if here his adduction power is impaired, he cannot adduct his thumb. I mean, in like this pattern, this is normal. This is normal. Where this is interphalangeal joint, they are straight. They are straight. But see in this picture, you cannot see because of overwriting. Here he cannot uh, tighten because of the weakness, and this weakness
Hmm.
is because of adductor pollicis. Adductor pollicis, and it is supplied by the ulnar nerve.
The policy supplied by the ulnar nerve.
Ulnar nerve, and this is
But
called
also, doctor, over
mhm,
here it says, in the question it says that has lost the ability to adduct the fingers.
adduct.
So
Yes,
adduction, it is done by the
thumb,
crochet muscle then.
thumb movement. When we will read, this is part B question. All the movement of the thumb. Okay, adduction, abduction. You cannot see the picture. Adduction, abduction, circumduction, opposition. Okay, thumb adduction mainly provided by ulnar nerve. We will see next, just maybe after 2 3 pages, we have this in this
Yeah. I
explanation.
agree. But on the question, it doesn't say thumb. It says fingers.
Finger. Here, thumb and the fingers. This adduction is by adduction. Adduction. How you will? You cannot see me. Adduction. When? What will be the adduction? I mean, yes.
This.
When you, yes, this is adduction. Adduction. So for the thumb also, thumb adduction. What will be the movement of the thumb for the adduction? Adduction, abduction. This thumb, yeah, take medially near the palm. This is adduction. This function will be impaired. That is why, see, in this affected finger, he is not able to do that movement. So only with the tip of the thumb, this patient, he is using tip of the thumb, which is supplied by FDP. FDP will not be here. In the thumb, FDP will not be there. So this is called Foreman sign. And
Foreman sign.
Foreman sign indicates that patient has ulnar nerve injury.
Ulnar nerve injury. Adductor pollicis.
At all ulnar, adductor pollicis ulnar. Okay, another one. Read.
A 23-year-old man is involved in the fight outside the club and sustains a laceration in his right arm. On examination, he has lost extension of the fingers. Extension of the fingers. So
Hmm.
extensor compartment, radial nerve.
Yeah. Yes. Extensor means radial. Extension radial nerve. So radial nerve supplies home. Radial nerve supplies the
Beast.
beast. B for brachioradialis. E for
Brachioradialis.
extensors of the forearm.
Extensor of the forearms.
A
Supinator. Supinatus.
Anconius, S supinator,
Anconius.
and
Supinator triceps.
T triceps.
Okay.
Now here, this is posterior aspect in the axilla. In part B, actually, there is a lot of expansion and question from this part. Triangular space. Okay, this is triangular space, and this is quadrangular space,
Hmm.
and this is called triceps hiatus. Okay, this boundary. Different time they ask about boundary, they ask about the content. First, we learn about the boundary. This is teres minor muscle, one muscle teres minor, minor in the up, major in the down, because major has to hold two long muscle. One is triceps, long head, another one is humerus head. So humerus is a big muscle, and long head of triceps also big muscle. It has to hold by a major muscle. So Normally, major will come down. This is how we can
Yeah.
remember. Otherwise, it is confusing. Teres minor or major, which one is down? So down, someone who can hold, actually strong. So teres major will be in the inferior border by teres major, superior border by teres minor, medial border by long head of triceps, and lateral border by humerus. And they form this quadrangular space. What are the content of this quadrangular space? We have axillary nerve. Axillary nerve coming from where?
Posterior cord.
Very good. And posterior circumflex humeral artery. It is coming from where?
Posterior circumflex humeral artery. Axillary artery. Third.
Third
Third
part.
one. Third.
Very good. Very good. Third part of the axillary artery. So from quadrangular space, we have axillary nerve and posterior circumflex humeral artery. And from triangular triceps hiatus. Triceps hiatus, we have radial nerve. We have radial nerve here. Radial nerve, and here we have deep brachial artery, profunda brachii artery. Okay, profunda brachii artery, actually the deep brachial arteries. How brachial artery coming from? Brachial artery coming from where?
Subclavian artery.
Is it? Brachial artery is the continuation of axillary artery.
Oh, sorry. Yeah.
Mhm.
Which is a continuation of subclavian artery.
Yeah, you can say. So this brachial artery and radial nerve, they are like very close relative. Radial nerve and brachial artery, they remain together. Okay.
Okay. All right.
Now,
So okay. So quadrangular space, triangular interval, and triangular space. Yeah.
yeah, three different. For part A, mainly they need to know in quadrangular space. In quadrangular space, which nerve emerged or which nerve remained? What is the medial boundary? Which of the following muscle forms the medial boundary of quadrangular space? Okay,
Triceps. Yeah.
triceps, long-headed triceps. Now, rotator cuff muscle. These all are part B question, all as it is. Okay, we can remember very simply SITS, sits, SIT, and down there will be S. S for supraspinatus, then I for infraspinatus, and T for teres minor. 1, 2, 3. These are in the greater tubercle. These muscles are attached in the greater tubercle. And in the lesser tubercle, this is small another S, that is subscapularis. Subscapularis. Okay.
Scapularis.
So
Rotator cuff muscle.
rotator cuff muscle.
Yeah. Yeah.
Supraspinatus, infraspinatus, teres minor,
Teres
and
minor. They are a greater tubercle,
subscapularis.
and the lesser tubercle is the subscapularis.
Subscapularis.
Yeah.
Yeah, Dr. Sanjita, what is the muscle of the rotator cuff?
Rotator cuff is হচ্ছে যে supraspinatus, infraspinatus, teres minor আর subscapularis.
Yes. Now, rotator supraspinatus, you see their orientation. This is here will be the spine, right? Spine of the scapula. So the muscle above the spine is supraspinatus muscle. Okay. Muscle below the spine is infraspinatus. Okay. And this is scapula. The below the scapula is subscapularis. This is below the scapula, subscapularis. And here we have a minor muscle, teres minor, teres minor,
Minor.
teres minor. Okay. Now, this is exam question. Their nerve supply, supraspinatus and
Supraspinatus.
infraspinatus, both are supplied by the suprascapular nerve. We
Suprascapular
have,
nerves.
mhm. And teres minor, we have seen
Axillary.
with axillary, it gets supplied from
Axillary nerve.
axillary nerve. With deltoid, teres minor and deltoid both are supplied by axillary nerve. And subscapularis. So it is by subscapular nerve, which upper and lower subscapular nerve. Upper and lower subscapular nerve. 16. This ulnar nerve, remember UL, upper and lower
Yeah.
subscapular nerve from the
Subscapular
posterior,
nerve. So it supplies subscapularis. Okay.
and it is coming from posterior cord. So, Dr. Jafar, can you recall quickly rotator cuff muscle and their nerve supply?
So rotator cuff muscles sit, or the mnemonic of sit on the graded tubercle, let's say supraspinatus, infraspinatus, and teres minor, and the lesser tubercle is the subscapularis. So supraspinatus and infraspinatus they are supplied by the suprascapular nerve, and the teres minor is by the axillary nerve, and the subscapularis is by the upper and the lower subscapular nerve.
Mhm. Now their action. Supraspinatus. It is called the initiator of shoulder abduction. Initiator of the shoulder abduction. It causes shoulder abduction from shoulder abduction. We have different uh, degrees from 0 to 15 degrees.
10 to
0
15.
to, mhm, 0 to 15 by supraspinatus.
Supraspinatus.
So it causes initiation of abduction of the shoulder.
Initiation of the
Then
shoulder abduction.
infraspinatus and teres minor. They causes lateral rotation of the shoulder joint. Infraspinatus and teres minor, lateral rotation of the shoulder joint. And subscapularis causes medial rotation of the shoulder joint. Okay. Again, supraspinatus, initiation of shoulder abduction. Infraspinatus and teres minor, lateral rotation, and subscapularis, medial rotation.
Medial rotation.
So we said initiation of abduction from 0 to 15 degree by supraspinatus, then from
And then
15
left
to 90 degree shoulder
degree is
abduction,
deltoid.
deltoid, and above 15, above 90 degree,
Above 9 pect major.
hmm, pect major,
Above 90 degree.
hmm,
Latissimus. No, not latissimus dorsi.
this is the back muscle. Remember, back muscle. We have seen
Yeah.
trapezius,
Which
trapezius,
trapezius?
trapezius,
Oh.
along with trapezius and serratus anterior also will take part, both. So again, 0 to 15 degree by supraspinatus, 15 to 90
Supraspinatus.
degree by deltoid, and then above
Deltoid.
90 degree by trapezius along
Trapezius.
with serratus anterior. Okay. Now again we are with the artery. Before we have seen the branches of the axillary artery, right? Three part of
Axillary
the
artery.
axillary artery from first segment one artery, second segment two, and third segment three. Now subclavian artery, very 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 important. Subclavian artery. Subclavian artery.
Subclavian.
We need to know their branches. Very important. Subclavian artery, their branches we can remember by the mnemonic vitamin C and D. VIT,
Vitamin C and D.
vitamin C and D. So V for vertebral artery, I for internal thoracic artery,
Internal thoracic artery.
T for thyrocervical trunk,
Thyrocervical trunk.
C for
Costocervical
costocervical
trunk.
trunk, and D for dorsal scapular artery. Very nice. Vertebral artery, internal thoracic artery, thyrocervical trunk, costocervical trunk, and dorsal scapular artery. These are the branches of subclavian artery. How subclavian artery becoming axillary artery?
Lower border, lateral border of the first rib.
First, yeah. And subclavian how becoming, sorry, axillary how becoming brachial?
Uh, teres major, teres minor. I am struggling. I can store a lot of information, but not this. No, axillary. You said axillary or
This is something major.
teres major.
Yes,
Teres
and
major
teres major.
divides. Yeah, teres
Teres
major
major.
divides axillary to brachial, like continues.
Yeah.
And then pect minor is the three parts, axillary
Hmm.
to three parts.
Yes.
Branches of subclavian artery.
Both of you can just tell the names, so it will be your revision. What are the branches of the subclavian artery?
Is vertebral artery, internal thoracic artery, thoracocervical trunk,
Thyro,
costocervical trunk, and sorry,
thyrocervical.
thyrocervical trunk, costocervical trunk, and dorsal scapular trunk.
Yeah,
Yeah,
you can repeat. That's it.
yeah. So vitamin C, D, uh, a vertebral artery, internal thoracic artery, thyrocervical trunk, costocervical trunk, and dorsal scapula.
Okay. Now, lower body of the chest, mother, brachial artery. Okay. Axillary artery divided by the three part by pectoralis minor and then axillary artery, lower border of the chest, mother, brachial artery, outer border of the first rib, divided into three parts by second veins. You can see this is neater picture, I think. This is axillary artery, big axillary artery, axillary artery, axillary artery, axillary artery. Before axillary, we have subclavian, where we have seen vertebral artery, internal thoracic artery, thoracocervical trunk, costocervical trunk, and dorsal scapular artery. Okay.
Dorsal scapular artery.
Now, then we have axillary artery, axillary artery. Then we
Pect
have
minor
brachial
artery.
artery, brachial
Brachial artery.
artery here giving a deep branch, profunda brachii. Profunda brachii is kind of deep brachial artery. Deep brachial arteries, another name is profunda brachii artery. Profunda femoris, remember profunda femoris?
Mm-hmm. That is the
Just
deep
like
branch
that,
of the femoral artery.
femoral artery. So here also deep branch of the brachial artery is profunda brachii. Femoral A brachial artery passes elbow anteriorly and then divides into two parts. One is radial artery, radial side, and ulnar artery, ulnar side. We check pulse mainly in the brachial artery, right? Subclavian artery, first part, second part, third part. Whatever we have seen in the picture, this is just the explanation of subclavian and axillary arteries. You can have a look. Now, okay. Now hand muscle. We said there are four lumbricals supplied by both median nerve and ulnar nerve.
And the
Lateral
ulnar nerve.
lateral two is by the median nerve and
Yeah.
ulnar side two
Medial
by
2.
ulnar nerve. Medial two by
Hmm.
ulnar nerve.
Hmm.
See the
Yeah.
orientation of the lumbricals. Orientation of the lumbricals.
Hmm.
Just imagine your hand. This is your right hand. You can see your right hand, and these are the lumbricals. Okay. It is attaching into the lateral aspect of the proximal phalanx. Proximal phalanx, proximal phalanx, proximal phalanx, proximal phalanx, and the lateral aspect. Now have palmar interocyte, which causes abduction. Abduction. Palmar interocyte has three. One,
Adduction.
two, three. Adduction. Adduction. Palmar interocyte. Palmar interocyte causes
Cause
adduction,
adduction.
and if it is dorsal interocyte, it is opposite. It causes abduction. It takes away.
Abduction.
You can see the arrow in the red arrow. It takes the finger away from the midline. This is midline, axial line, and this muscle when they act, because it is also attached in the lateral aspect, see, it takes away. So palmar interocyte causes adduction, dorsal interocyte
Yes.
causes abduction.
Causes abduction.
Both palmar interocyte and dorsal interocyte all are supplied by the ulnar nerve.
Yeah.
All are supplied by the ulnar nerve. So you
Ulnar.
remember at all ulnar adduction of the finger is by ulnar nerve.
Hmm.
Adduction of the finger is by ulnar nerve. Now muscle of the hand. This is difficult, but known to.
Hello.
Yeah, you join. Good.
Hello.
Yeah, I can hear you, doctor.
Cannot hear you.
Hello, you can hear me? Hello, can you hear me, doctor? Hello. Hello. Can hear me? Dr. Zonia? Hello.
Hello, भैया.
Yeah, can hear me now, Dr. Sanjida?
Yeah, I can hear you.
Mm, Dr. Zonia, you can hear me? Hello. Hello. Uh, we will continue. Okay. So we have palmar interossei and dorsal interossei. All the interossei are supplied by ulnar nerve. Now, just remember these key points. Median nerve, median nerve,
Mutual ligation भैया. We connect হচ্ছে না.
হ্যাঁ, এই তো
ওনারটা প্রিপারেশন ভাইয়া অনেক ভালো. আমি তো এটা দেখেছি.
কোনো অসুবিধা নেই। Hello. Dr. Zonia, you can hear me now? You are muted.
I can
Okay.
hear you.
Okay. Yeah. So we said we have four lumbricals supplied by median and ulnar nerve. We have palmar interossei, three in number. Remember, palmar interossei are three in number, but dorsal interossei four in number. Palmar interossei three and dorsal interossei four. Okay. Palmar interossei causes adduction, dorsal interossei causes abduction.
Abduction.
Here are some root points we remember. Median nerve, all of the flexors in the forearm except flexor carpi ulnaris and medial half of the flexor digitorum profundus, which is supplied by the ulnar nerve. And just now we have seen all interossei are supplied by the ulnar nerve. Also, medial half of the flexor digitorum profundus and flexor carpi ulnaris are supplied by the ulnar nerve.
Mm-hmm.
Ulnar nerve, all
Yes.
intrinsic muscle supplied by the ulnar nerve,
Muscle.
except
Ulnar nerve. Yeah.
LOAF. From here, minimum two question you will get in this. Minimum. Only from this information. So ulnar nerve gives supply. See, a common rules we made that all intrinsic, here we have seen interossei. All interossei, no doubt, all interossei muscles supplied by the
Introsei are
ulnar nerve.
supplied by the ulnar nerve.
But all
Then all the
interossei
intrinsic
muscles,
muscles.
yeah, interossei and intrinsic, these are different. Okay. All the intrinsic muscle except LOAF. This LOAF is supplied by the median nerve because we have seen yesterday. This hand always there is a fighting between median nerve and ulnar nerve, right? So the part supplied by the median nerve remaining will be by the ulnar nerve. So all intrinsic are supplied by the ulnar nerve except LOAF. What is LOAF? It is lateral two lumbricals Opponens pollicis,
Operans pollicis,
abductor
abductor
pollicis
brevis,
brevis, flexor pollicis
flexor
brevis.
pollicis brevis.
How you will remember? This is your technique, but anyhow you have to remember. Especially this A. This A is very confusing. This is adductor or abductor, pollicis or brevis.
Abductor.
This is the confusion.
Mm,
You remember abductor pollicis, either it is brevis or uh, eh,
mm,
there is confusion. So
mm,
read it again and again and again. Some
mm.
people remember it like pad and dab. PAD pad, P for Palmer,
Palmar inversiae, adduction.
adduction. AD is adduction and AB is abduction.
Abduction, dab.
Dab. Okay. So lumbrical one and two is supplied by the median nerve. Lumbrical 3 and 4, dorsal interossei, palmar interossei, all are by the deep branch of the ulnar nerve.
Ulnar.
Adpol, adpol, adductor pollicis. Remember adductor pollicis?
That is
Adpol,
supplied by
adductor
ulnar.
pollicis by ulnar nerve. Flexor pollicis brevis, opponens pollicis, abductor pollicis brevis. These are by median nerve,
Median
and
nerve.
this is
Hmm.
the recurrent branch of the median nerve.
Hmm.
Recurrent branch of the median nerve. Okay, this is flexor retinaculum. Only the foolish median nerve goes below the flexor
Below the
retinaculum.
flexor retinaculum.
Below the flexor retinaculum. All other nerves, they will go above, but
Hmm.
only median nerve goes below the flexor retinaculum. That's why
Below the flexor
in
retinaculum.
different
Carpal
condition,
tunnel.
this nerve get entrapped
Trapped.
because other structures are solid and stronger, like the bony structure or the tendon. So there is a condition called carpal tunnel
Carpal tunnel
syndrome.
syndrome. CTAN.
Yeah. In part B, you have to remember this structure, but for part A, no need to remember all these structures serially. No need actually. Okay, almost finished. Now, this is anatomical snap box.
Anatomical snuff box. Radial
This is
nerve.
also mhm, important topic, and from here you will get 1 mark, one question. Especially they ask about the boundary and the content. So the boundary. This is also a confusing question. You can see this figure anterior-laterally. Anterior, if you keep your hand, learn it with your own hands. Anatomically, when we keep the palm of the hand faces anteriorly or upward, this is anatomical position. So now just remember anterior laterally. So this is basically the back part, back part. So back or posterior is like the radial. We know this one, right? Anterior posteriorly radial and posterior medially what happens? Posterior medially, my PDF gone. You can see the PDF. Okay. So posterior medially is by ulnar. Now the muscle or the tendon. So anterior laterally abductor pollicis longus, abductor pollicis longus. You can see here in this picture. Abductor pollicis longus, abductor pollicis longus, and extensor pollicis brevis. With abductor pollicis longus, extensor pollicis brevis. These two remains in the, if you keep your hand anatomically, then it is posterior later, anterior laterally, anterior laterally, anterior laterally, anterior laterally, anterior laterally, means the first border you will encounter. Okay, that is extensor pollicis brevis, this one, extensor pollicis brevis, and abductor pollicis longus. And posterior medially, we have extensor pollicis longus. It is okay.
Posterolaterally is abductor pollicis longus and extensor pollicis brevis.
Medially will be one, laterally will be
Medially
two.
will be extensor pollicis. Okay.
Medially will be only extensor pollicis
One.
longus.
Okay.
Yeah, medially extensor pollicis longus. This is medial. Extensor pollicis longus. It is why longus? It goes up to the distal phalanx. This is extensor pollicis longus. Okay, this is medially. Extensor pollicis longus. This one. And this is the same one, extensor pollicis longus. Extensor pollicis longus tendon. This is medially. And laterally will be two. Which two? One is
Abductor
abductor
pollicis.
pollicis longus. Here we have abductor pollicis longus and extensor pollicis brevis. Extensor pollicis brevis. This is extensor pollicis brevis. And along with this, have abductor pollicis longus. Difficult, but if you read again and again, maybe you will find out your own way to remember. Now it's content. Content you can remember with this CARS, C-A-R-S, CAR, C-A-R-S, C-A-R-S, C for cephalic vein, A for artery, which artery? Radial artery,
Radial artery, radial nerve.
R for radial nerve, which branch? Superficial branch. Okay, this is for superficial. So, cephalic vein, radial artery, and radial nerve.
Isn't S for scaphoid?
That is bone. Bone will not come as a content. Okay, you can even remember scaphoid also. Scaphoid also remains in the same location. Anatomical snap box. The bone is scaphoid bone. Scaphoid is supplied by the branches from the radial artery from the distal part. So it is subjected to avascular necrosis when fractured. Right? There will be question if there is any avascular necrosis. Okay. Suppose
So what was
scaphoid,
C? Cephalic vein.
cephalic vein. Yeah, cephalic vein, radial artery, and radial nerve. Scaphoid, something like this. This is scaphoid. Okay. All the bones, most of the bone. Suppose here is the scaphoid bone. This is scaphoid. Normally, we get supply from proximal to distal, right? From this part, blood supply should enter. But scaphoid is different. It gets supply retrograde from downside. It gets supply from the lower part. So if there is any transverse fracture here, only blood supply it is coming from the down part or from the distal part. So distal part has the blood supply. but the proximal part was supposed to get supply from here. But as it is fractured, there will be no blood supply. So this part will undergo avascular necrosis. Normally, blood goes from proximal to distal, like from arm, as like we have seen subclavian. Then it goes to uh, axillary. Then it goes to brachial. But here it is opposite. First it is going to the brachial, then it is going to axillary, then it is going to subclavian. Kind of vein, like venous drainage, kind of venous drainage direction from down to up. So if there is, they make a tricky question. Sometimes they ask which part will will undergo avascular necrosis, proximal part or distal part. If there is scaphoid fracture, which part of the bone will undergo avascular necrosis, proximal part or distal part?
Distal.
Ha ha. Why distal?
Proximal.
Proximal. Because
Ah,
proximal is
okay.
getting supply from the distal.
Ah, okay.
So distal part have the blood supply because from distal part blood supply is entering. Okay, if you remember like that tree, this is the tree and
Hmm.
this is the root.
Hmm.
So
Hmm.
here, normally from the root it goes up, but for a scaphoid it is opposite. From the leaf, nutrition coming to the root. So if there is any cut down here, so root will die first, but leaf as it has supply, it will remain alive.
So the proximal receives its supply from the distal end, yeah?
Yes, yes. They make some tricky question like this. Ulnar nerve is ulnar to the ulnar artery. Okay. Ulnar means medial, right? And radial means lateral.
Lateral.
Yeah. So
So ulnar is
radial,
medial to ulnar artery and radial is lateral to radial artery. Oh, okay.
yes, yes. Just remember this. You can see this is cubital fossa. Cubital fossa, cubital fossa. This is medial side, lateral side, medial side, lateral side. Okay. From medial to lateral. This is median nerve, always remaining in the medially. Sorry, the mark I did. This is ulnar nerve. Ulnar nerve is
Yeah.
the most medial.
Always stays to the most medial, yeah. So
Yes,
it was the mnemonic was nerve, a median nerve, like lateral to medial. I remembered it like that. A nerve, a median nerve, then brachial artery, then muscle bicep tendon, and then ulnar nerve.
yes. Ulnar nerve will the most medial.
Yeah.
Okay.
So NAMN, I have remembered it like that. From lateral to medial.
Yeah, and we studied it like NBPR. NBPR. Okay. So there is the N actually. From here, this is not part of upper limb, but it, it came here by mistake. So now I have to read EMRCS. Okay. We will conclude our session here and read this lecture file properly. From upper limb, you will get
Yeah.
8 to 10 questions. So you need to
Yeah.
read actually. And once it is done properly, then start EMRCS. EMRCS, tomorrow also we will keep date for EMRCS.
Yeah,
Uh,
tomorrow we can discuss the MCQs.
yeah, EMRCS. I think I already shared with you these files, right? EMRCS and lecture
No,
file.
no, bhai, I didn't get the EMRCS.
Okay.
I think you shared the with the explanations one, yeah?
Mhm. This one, right?
Mm, yeah. Mm-hmm.
See, you can read the question.
Yeah. 10-year-old boy is admitted to the emergency department for an examination. There is a deformity and swelling of the forearm. Ability to flex the fingers of the affected leg is impaired. However, there is no sensory impairment. Imaging confirmed displaced forearm fracture. Which of the nerves listed below is likely to have been affected? Ulnar, posterior interosseous, anterior interosseous, axillary, or radial?
So it is clear cut. Ability of the flex finger is affected and no sensory impairment. No sensory impairment means it is a motor nerve and flexor of the finger is affected. So flexor is maintained by median nerve, and they said more specific that no sensory impairment. So pure motor median nerve. We know pure motor median nerve is AIN, anterior interosseous nerve.
Hmm. Hmm.
So it has no sensory supply. So the defect is motor alone. Anterior interosseous nerve. We have seen it supplies two and a half muscle. Flexor pollicis longus, then frontal quadratus,
Uh,
and flexor
pro
digitorum
flexor digitorum profundus
profundus.
laterally
PQ
radial arm.
pronotal quadratus. Flexor pollicis longus. FPL, PQ, and FTP. Then the next question.
Which of the following nerve supplies the skin of the palmar aspect of the thumb? Palmar aspect of the thumb. Median nerve, which is
Median nerve.
the 3.5 thenar and
Hmm. So here median nerve you have to read. I'll tell you. Okay, you can read. Median nerve, upper arm, no branches. In the forearm, they have these branches. We have seen lecture 5.
hmm.
And distal forearm, palmar cutaneous branch. And hand motor. Motor supply LOAF. Lateral to lumbricals, open pollicis, abductor pollicis brevis, and flexor pollicis brevis. In the hand sensory, we have seen cutaneous supply and pattern of the damage. Damage at the wrist, carpal tunnel syndrome, anterior interosseous nerve branch of the median nerve
Motor.
lives just below the elbow. Mhm. Next.
63-year-old lady is undergoing an part of breast cancer treatment. Which structure vestibular is likely be encountered? Yeah, so we studied three nerves,
Yes.
and intercostobrachial, and one was dorsal
Thoracodorsal and
and then the other one was long thoracic.
lung thoracic. Boundaries on the axillary is not important. Just we can have a look. That is important. Okay. Next.
45-year-old farm labor injuries injures the posterior aspect of the hand with a mechanical scythe. He severed some of his extensor tendons in this injury. How many tunnels in the external radiolaculum that transmit the tendons of the externus muscles?
This is straightforward, just a number. How many tunnels? How many tunnels? In the extensor retinaculum, 6 tunnels. How many tunnels? 6 tunnels.
Six tunnels, yeah, because yeah.
Okay. Now, next.
Which of the muscles is not innervated by the median nerve? Flexor pollicis brevis, lateral to lateral, opponens pollis, pronator teres, adductor pollicis, yeah, adpol, ulnar nerve.
Adpol ulnar, adpol ulnar, adpol ulnar, adductor pollicis by ulnar. Median nerve again same function. You can go for
A 23-year-old man is involved in the right outlet slug and the sustained relaxation of the arm. Examination lost of extension of the finger. So it is the radial nerve.
radial nerve. We have to read in details. Small loss of elbow extension if there is triceps injury. Beast, B-E-A-S-T. For this T, we have triceps. Now this axillary artery. Okay, we will keep up to here tonight. You can read it.
Yes.
Both of you can study. Even tomorrow, in my duty time, if you are free, I can open. See, there is one term. Okay, just allow me. Upper limb is easier than lower limb, or